My first question, which is my favourite question at the moment, is this is the your starter for 10. How many elected governments does the UK have? I've tried this on some fairly senior people in Whitehall recently, and they didn't have a clue, basically. And it is actually difficult to establish exactly how many elected governments we've got. In fact, there isn't a definitive number. Because there's a certain amount of churn in some of the most local bodies, town and parish councils in England and community councils in Wales and Scotland. But you will probably be surprised to know that we have over 12,000 elected governments in the UK. If you include central government, the 3 devolved governments, the 400 or so local governments in England, Scotland, Wales and Northern Ireland, and about 12,000 community level councils, town, parish and community councils across the country. And that's just the elected bit. There's whole swathes of public sector service delivery at local level, most notably the health service, but increasingly now things like education, which are actually controlled by non-elected bodies. So to some degree appointed by Whitehall, to some degree self-appointed in the localities. I think one of the first things that the pandemic illustrated is that this system is completely dysfunctional at the moment. There are, unlike systems of government in large countries of our sort of size, where you've got 2, 3 or 4 layers of government, most of which are formal federations. And you have institutionalized coordination mechanisms between all levels of government, so that it's routine and normal for different levels of government to be talking to one another and to be reasonably clear about what the division of labour is between different parts of government and what the division of respect and power is of the different levels of government. We have none of that in the UK, and it became blindingly apparent just between Whitehall, Cardiff, Edinburgh and Belfast, just how dysfunctional those arrangements were during the pandemic. The level of coordination just between those levels of government was appallingly bad. And when it came to local government, particularly in England, it was even worse. There was very, very little coordination. And I think there's 3 things about that, and this is not necessarily about the politics of the current government. This has been a problem for a very long time and affects both the major parties, I think. First of all, there's been a doctrine in Whitehall that Whitehall always knows best, and they will grudgingly respect the devolved governments, but only grudgingly. They completely disrespect local government, particularly in England, and their initial reaction in any situation is to centralise things. And you can add on to that the political nature of this government, which is centralisation plus privatisation. And I'll come back to that in a minute. So let's take a couple of the examples which Chris has already mentioned, which is the test and trace regime. Let's start off with testing, because it's one I actually know a little bit about. My very first job back in 1969 was as a lab technician in pharmaceuticals for ICI in Alderley Edge, as it was then. So I know a little bit about how pharma works. The fascinating thing right at the beginning of the pandemic around the test and trace thing was that they decided to set up these lighthouse laboratories in Milton Keynes, in Alderley Edge, in Glasgow, and so on. Mega labs that were going to do all the processing for COVID testing. The first thing about that is these labs didn't exist when they started doing it. So they were largely setting these things up from scratch. Two further things about it. Firstly, the people who were put in charge of them, with the exception of Glasgow, where Glasgow University got heavily involved, but the ones at Alderley Edge and at Milton Keynes were put into the hands of private sector contractors largely, who had no experience of setting up anything like this at all. Second thing to remember about this is that we have hundreds of labs in the UK capable of testing for COVID or switching to testing for COVID. We have laboratories across the NHS. We have laboratories across the private sector in the pharma industry. We have, and other bits of the private sector, and we have laboratories in the voluntary sector through things like the Wellcome Trust Foundation and through the university sector. So there were literally hundreds of laboratories that could have switched to testing, processing the tests for COVID. They were hammering on the door of government at the beginning of all of this and were largely ignored. And instead, the government decided to set up this massive testing operation through these highly centralised labs, some of which virtually collapsed. The Milton Keynes one, for example, virtually fell over completely several times during the early stages of the pandemic. So that's the testing side of things. The second aspect of that test and trace was obviously the tracing side. So they decided to set up this national tracing system, which of course only really covered England, or at least largely was restricted to England. Completely ignoring the fact that in English local authorities, we have public health departments and environmental health departments, people who are used to tracking and tracing things like outbreaks of food poisoning or sexually transmitted diseases. They've got experience in doing all of that. They were virtually ignored and sidelined for the first 12 to 18 months of the pandemic. And instead, contracts were put out to these a whole host of private sector companies, none of which had any experience at all of setting up any system like that. And the third thing in relation to those aspects of it, the test and trace side of the pandemic, was, if you remember, fairly early on, people wanted to volunteer to help out, not just with test and trace, but with things like ensuring that people in local communities who couldn't get out when the lockdowns were on were looked after, that they were getting their medicines and food supplies and all of those sorts of things. So what did they do? They set up a national central database where people could volunteer online. They got hundreds of thousands of people putting their names in. And then they thought to themselves, oh, what do we do with all of this? And they didn't have a clue. And in the end, eventually, grudgingly, they had to decentralise most of it to local authorities and hand it over to them and to local health services to try and do something with all these people who wanted to volunteer. And my point about this is it's not just a reaction to centralise, which is completely inappropriate in a situation like that. It's a complete lack of knowledge and understanding of the way the rest of the public sector works. People forget that in the UK system, take it by employment numbers, the civil service represents about 10% of the public sector. About 90% of the public sector is outside of the civil service, and senior civil servants in particular, in most cases, have zero knowledge of that 90% of the public sector. They've never worked in it, they've never worked with it, they don't come from it. It's changed a little bit in recent years, but that's basically the situation. And the same is true for politicians, by the way. We have very few politicians in Parliament who came through the local government route, for example, compared to, say, France or Germany, where it's fairly standard for people to work their way up the political ladder from local government or land or state level or regional government up to national government. That's we have some people like that in our political parties, but not a lot. So it's not even for me an ideological question about whether or not you involve the private sector. It's with this government, it was they involved the wrong bits of the private sector. The private sector laboratories, for example, could have played a really big role in this and a very effective role. And they were just ignored. The supermarkets were left to their own devices to get on with managing all of this, where they could have actually been engaged, particularly at local level, through some sorts of local communication, local coordination mechanisms between local government and local private industries like the supermarkets, who were absolutely crucial, and the voluntary sector and volunteers. You could have organised things much, much more effectively than we managed to. Some of that was actually done from the ground up. I know I live in Bedford, and some of the churches and mosques and gurdwaras were very fast off the mark in starting to organise volunteers to make sure people were looked after properly. A lot of them were used as venues for the vaccination campaigns when it got started and so on. But there was no central effort to do all of that from central government. And I think what this illustrates for me is that we have muddled through with reforming our governmental structures in the UK for far too long. And I think Christopher's point about saying that we need a thorough, really thorough rethink about where powers are distributed within the governmental system, who's responsible for various things, and how we actually organise in emergency situations like this, because this won't be the last time we face something like a pandemic or some other sort of crisis. And we could well see multiple crises over this winter with flu and COVID still around, and possibility of power cuts and fuel shortages and various other things. And at the moment, we are really badly set up in governmental terms to handle all of those things. I'll stop. There's a lot else I could say, but I'll stop at that point, and let's see what other people have got to say and ask about.